HIV is a life-changing condition with many devastating effects. Millions struggle from this virus each day, but not only do the direct symptoms of the virus damage the condition of the patient, it also has serious neurocognitive implications. On a smaller scale, this could mean trouble concentrating, lack of coordination, or change in personality, but on a larger scale, this could mean HIV-associated dementia. Dementia affects over 5 million people in the US alone. People slowly lose their cognitive function and memory, gradually even losing their ability to recognize loved ones, and HIV is a great contributor to this. Over 1.2 million people in America have HIV, and as many as 38 million globally. HIV is contracted through the exchange of specific bodily fluids, such as blood, semen, and breast milk, so this could be transferred through unprotected sex, breastfeeding, or injecting drugs. HIV-associated neurocognitive disorders, or HANDs, affect between 15 and 50% of people with HIV. The estimates vary due to the varying severity of the disease, as well as the fact that it can only be diagnosed through a very specific series of tests. Specific symptoms of HANDs include decline in concentration, ability, coordination, the ability to process information, and changes in mood. HIV is a virus that lives in the bloodstream. It attacks white blood cells, weakening the patient's immune response ability. The HIV cells infiltrate the brain using the Trojan horse method, which is where the pathogens hijack the white blood cells, then diffuse across the blood-brain barrier, and explode the cells as soon as they make it to the other side. The blood-brain barrier is a membrane surrounding the brain's blood supply that works to prevent pathogens from entering the brain. It's a specialized membrane that makes it really difficult to be penetrated as the brain's blood supply is super sensitive and prone to tampering. The HIV cells are able to bypass this security method using the Trojan horse method. Right now, there are several ways to diagnose symptoms of neurocognitive disorders. These include mental status exams, X-rays, CT and MRI scans, spinal taps, and many others. And while these methods work well, they come with many complications and downsides. Mental exams may not be accurate with detecting HIV disorders in the brain. Lumbar punctures or spinal taps are a very long and tedious process, and they may risk injury to the patient, especially if they're elderly. The scans and X-rays work just fine, but many only detect some of the disorders, and they definitely aren't available to everyone. Our solution is to use brain-computer interfaces and neuromedicine in the brain to target HIV cells and prevent neurocognitive disorders. The nanomedicine will be encompassed by biogels, which are non-toxic biodegradable boxes that open up and release the medicine, degrading into naturally occurring materials once they reach the correct part of the brain, which in this case is the temporal lobe, specifically the hippocampus, which is the part of the brain associated with memory. The release of the nanomedicines will be controlled by a multi-unit invasive brain-computer interface because even at the nanoscale, it's challenging for materials to penetrate the blood-brain barrier, which won't be necessary if they're already inside of the brain. The type of invasive BCI that we chose for our idea was intracortical implants. There are 3 main types of invasive BCIs: electrocorticography or ECOG, siege, which is stereotactic encephalography, and intracortical implants. Electrocorticography wasn't correct for this because it only is on the outside of the brain and in the prefrontal cortex, which isn't the right part. The siege wasn't appropriate because although it's able to penetrate the surface, it's not meant for internal operations. This is why the intracortical implant was perfect, because it has electrodes that penetrate into the brain, and it's the perfect fit. This is the path to a better future for millions who suffer from HIV every day. The combination of nanomedicine and brain-computer interfaces has the potential to change lives and ensure better outcomes for millions of people who struggle with HIV. We can better combat this horrible condition.